everyone, welcome to today's episode of Medical Room. Here I'm AIZA. I'm honored to be your moderator today of today's discussion. We are fortunate to bring a diverse and highly experienced panel of professionals with us today. Each panelist represent a unique aspect of the healthcare field, and together we provide us with invaluable insight today. So let me introduce you guys. Here we have Ms. AIMAN, a pharmacist currently serving as the chief pharmacist at AZRIN Medical Center, specialized in pharmaceutical care and drug safety with 10 years of experience. And next we have Ms. AQEELAH, a senior nurse at Kuala Bayu Hospital, intensive care unit ICU, brings 50 years of hand-on patient care experience. And lastly, we have Dr. FARHANA, a highly respected surgeon specializing in the diagnosis and surgical, has performed over 6 years of experience. So guys, each panelist have bring a wealth of knowledge and a distinct perspective to our discussion today, and I'm confident that they will contribute with inspired and meaningful talk and provide practical takeaway for all of us. Okay, so the increasing reliance on AI raises concerns about whether technology will one day replace human judgment in patient care. So without further ado, let's get started. To begin, I will invite to you guys Ms. AIMAN to share the talk.
So for the speaker statement, it's actually interesting whether AI is actually going to take over the jobs of the people in the medical industry. So for me as a pharmacist, it actually helps us a lot, and it has a couple of pros. So for example, AI tools, it can provide us the correct medication and the correct dosage according to the patient. And sometimes, as we all know, a drug, they maybe interact with the other drug in the body. So for the AI to detect it, it's actually really helpful for us pharmacists, so we can actually be cautious for the drugs. And it also can provide personalized patient care. So as we all know, a patient, we need a treatment plan. So for the treatment plan to work, we need the history of the patient, like for example the genetic information or the medical history of the patient or the medical history of their family, so we know what kind of diseases that they have. So with this information, AI can actually personalize it in a matter of seconds or in a matter of minutes. So it actually saves us a lot of time. So it can actually improve the outcomes that the treatment that we use for the patient.
I see. Thank you, Ms. ATHIRAH. And now we move on to Ms. Anis. As someone who works directly with patients, how do you see AI will impact in day-to-day care provided by nurses?
Okay, thank you for the questions. So for me, as I represent the nurse profession, from our perspective, the increases usage of artificial intelligence in patient care might reduce the human interaction between the patient and also the caretaker. While artificial intelligence can improve efficiency, it can also reduce the time nurse and also the patient spend together. Over-reliance on automated systems may lead to less face-to-face interaction, which is a cornerstone of patient-centered care. So by the survey, 2022 survey by the AMA, revealed that 78% of nurses felt that increased use of technology had reduced their direct interaction with the patient. So this underscores the importance of maintaining a balance of using AI to support care and not to replace the human interaction between nurse and also the patient. So that's what I think.
Thank you, Ms. AQEELAH, with your talk about nurse. As we know, nurse play a very important role in patient care. So next we have a neurosurgeon, Dr. FARHANA. So what do you think about AI? AI is increasingly being used in areas like robotic surgery and diagnostic imaging. So as a surgeon, how do you see AI shaping the future of surgery?
Okay. Alright. Thank you to our lovely Miss Moderator, Miss ADEELA. So, as a doctor, as a neurosurgeon itself, I think AI is revolutionizing the field of surgery. So, its potential impact and is remarkable. As a surgeon, here are how I see AI shaping the future of our professions itself. Firstly, it enhances the precision in robotic surgery. So AI is powered by robotic system, making surgeries more accurate and minimally invasive. And then by reducing the human error and enabling precision, they improve outcomes and recovery times. So it makes all the invasiveness of the skin itself make it faster. So next, in the future, AI could even facilitate autonomous robotic procedures for routine surgeries and under careful human oversight. Next, it can improve diagnostic imaging. So AI is transforming a diagnostic imaging by analyzing the complex data from CT scans, MRIs, and ultrasounds. Same like our pharmacist, Ms. ATHIRAH said just now, as the AI helping in giving the most therapeutic dosage for all the patients. So by in surgery department, they improving the diagnostic of the imaging, and then it can detect abnormalities with incredible accuracy, helping surgeons plan procedure more effectively. And then it will imagine AI system highlighting tumor boundaries or vascular anomalies in real time. And then lastly, it can personalize surgical plans or like giving the most suitable treatment for each patient. So with its ability to process vast amounts of patient-specific data, AI can create tailored surgical strategies based on anatomy, medical history, and risk factors. So this will personalized approach ensure better outcomes and fewer complications. Okay, that's all from me.
Okay, wow, that's a big explanation from Dr. AIREEN. And now we go back with our pharmacist, Ms. AIMAN and ATHIRAH. So my next question is, how do you think pharmacists can adapt to the increasing integration of AI to ensure it complements rather than replace their expertise?
Alright, so for the question, it's actually a really good question since we all think that AI will eventually replace us as the medical professions in the medical field, but it actually can be compromised by a few things. So actually we as pharmacists, for me, pharmacists, we can adapt to the increasing role of AI. So this is by actively learning on how to use these technologies rather than just relying on other person to use it. So by this continuous education and the training tool that we use for the AI, it actually can help us understand more on how to interpret the AI language. Instead of relying just blindly on the AI. So basically we don't just rely on the AI 100% because the AI may make mistakes. It's not just human because human program the AI. So the AI may make mistakes as well. So we as humans that has knowledge, it's our responsibility to double check whether the AI information is correct or not. So that's all.
Okay, thank you, Ms. ATHIRAH. And now for Ms. AQEELAH. From your explanation just now, from the first question, now I want to ask you, do you think that AI can ever replicate the emotional intelligence and empathy that nurse bring to the patient care?
Okay, so I personally think that AI cannot fully replicate emotional intelligence and also empathy. While AI can stimulate conversational empathy through chatbots or offer personalized responses based on the data, the ability to truly connect with a patient on an emotional level is uniquely human. Empathy involves understanding the nuance of verbal and also non-verbal communication, cultural sensitivities, and individual circumstances. These factors require intuition, compassion, and a level of human understanding than AI lacks. I think that's all.
So nurses are better than AI. So next, for Dr. Irene, how do you think AI will ever replace surgeons in the operating room, or it will remain a tool to enhance precision and efficacy?
Okay, thank you for the question. So the questions of whether AI will replace surgeons in the operating room is a fascinating one. Personally, I believe AI is more likely to remain a tool to enhance precision, efficiency, and patient outcomes rather than completely replace the human surgeons itself. Here's why. Firstly, is human intuitions and decision making. So surgery isn't just a technical task. It requires critical thinking, creativity, and the ability to make nuanced decisions in unexpected situations. So while AI excels in data analysis and pattern recognition, so it lacks in the intuitions and adaptability that human surgeons bring to the operating room. So next is the patient connection itself. So a surgeon's role isn't limited to performing procedure. It involves understanding patient needs, fears, and goals. So building trust and providing reassurance are uniquely human aspects of care that AI simply cannot replicate. So as the end, AI has already proven to be a game changer in the surgical field itself, but I see it as a partner, not a replacement. So by working together, humans and AI can achieve remarkable outcomes. So that's all for me.
Okay, I think our panels need some break, so we'll be back after this. Hello, welcome back. So our panelists have drank the coffee and tea just now, so I think that's not a problem to us to continue with our discussion today about AI. So, continue with our very experienced pharmacist. Okay, so Miss ATHIRAH, this is my maybe last question for you. So, are you think there are specific challenges you foresee in with AI with pharmacists, such as ethical concern or risk to patient safety?
Alright, so for the challenges that we face about the AI in pharmacy, so AI is actually, as we all know, AI is a technology, and technology is never secure because anybody can have access, whether it's a normal person or it's a person with a high knowledge. So basically anybody has access to the personal information that we keep in the technology. So same goes to AI. So even though AI, they bring many advantages and maybe some pros that we pharmacy have, but one of the major issues that we face is the data privacy about our patient, because even though it feels like it's safe in the AI, but it's actually not, because if we do not check the security level in our AI, if we continue to ignore it, there may be a high chance that a hacker or anybody can try to breach our data and maybe steal our patient's information, and that basically violates our moral to keep our patient's identity safe. So it's actually the biggest issue that we face. And aside from that, it's also about accountability. So as I said before, AI helps us to recommend the drugs that we use for the patients and as well as a treatment plan. But if the AI made mistakes and the pharmacist made a mistake, we actually do not know who is at fault. So whether we want to blame the AI or we want to blame the pharmacist, so it's actually unclear because both play roles in deciding the best drug for the patients. So that's basically the major issues that we as pharmacists face.
Okay, I see. As a maybe patient, I also scared about my personal or data privacy being watched by everyone. So next, for our nurse here, Miss AQEELAH, how do you balance using AI tools such as automatic monitoring system while still maintaining personal connection with patients?
The key to balancing AI tools and personal connection lies in integrating AI as a supporting tool and not a replacement. Nurses can use AI to handle repetitive and data-intensive tasks, freeing up time to focus on their interpersonal roles. So here's how the balance can be achieved, which is to always be present with the patient. So while AI monitors patient, nurses can use the free up time to interact with the patient more deeply, such as asking about their concerns, building trust with the patient, and also providing reassurance. And next, nurses, doctors, and other healthcare providers also need to be trained in using AI tools responsibly, understanding the limitation and also the potential bias of AI can help them inform decision.
Okay, as I can conclude, responsibility is the important key.
Yes.
Okay, last for our neurosurgeon here, Dr. AIREEN. How do you address concern about potential over-reliance on AI during critical procedures?
Concerns about over-reliance on AI during critical procedures are valid and deserve serious attention actually. So while AI has proven to be an invaluable tool, it's crucial to strike the right balance between leveraging its strength and maintaining human oversight. So here's how I think we can address these concerns. So firstly, by maintaining the surgical expertise. So AI should never replace foundational surgical skills. So surgeon must be trained to perform procedure manually and understand every steps of the process. So this will ensure that even in the rare event of AI malfunction, the surgeon is fully capable of completing the procedure safely. And then, using the AI as an assistant, not a decision maker itself. So AI is most effective as a supportive tool. For example, it can analyze data, suggest actions, or identify the complication, but the surgeon should always have the final say. This ensures accountability remains with the human professional. So lastly, to balancing the automation with human oversight. So for critical procedure, AI should act as a collaborator, not an autonomous operator. So surgeons should use it to enhance precision and efficiency while maintaining full control over the procedure itself. So lastly, over-reliance on AI is a valid concern, but it's one we can manage through thoughtful implementation, robust training, and a commitment to human oversight. AI is here to empower surgeons, not replace their judgment.
Okay, thank you for Dr. AIREEN, FARHANA, for the long explanation. So next, for our last round, I would ask
So open Q&A.
for our last round, for our three panels here, I would ask, I would like to open this up for group discussion. Okay, so any of three of you, did you guys think there is a specific area in healthcare where AI might pose the greatest challenge to human judgment?
Alright, let me start first. For this question, for me, one of the biggest challenge that AI may pose is that it will pose a big challenge to medication safety and the patient counseling. For the medication safety, it may analyze the drug interaction and recommend treatment, so it may understand. But the thing is, it's an AI. So if it's an AI, it will strictly follow the information that they have. They cannot make complex decision and they cannot think out of the box. So let's say if a patient, they have a rare disease, so basically they may have a bit of a trouble, and maybe they will recommend the wrong treatment for the patient. And second of all is about the patient counseling. So for this point, what I wanted to say is, the pharmacists actually they provide reassurance for the patient. So we explain the medication side effects, and we make sure that the patient that receive the drugs, they understand what they are taking. So for an AI to take over is most unlikely, because their challenge is that they speak based on a book, and not everybody will be able to understand what they understand. So they may provide information that normal people won't understand, but we as people who work in the medical profession will understand. So maybe the patient will have a misunderstanding, and it will cause a lot of trouble for everyone. So that's for my point.
I think from the three of us, pharmacist, nurse, and also doctor, I think pharmacists use a lot of artificial intelligence in your work, because as for me, I'm a nurse, so usually I take care of the patient. I do a lot of human touch, face-to-face conversation, and I take care of the patient, such as changing the patient's diapers. Up until today, 2025, there is no robot that can actually change patients' diapers and also do other work that nurses do. So I think it is less likely to have a greatest challenge in our perspective. That's from me.
Okay, so you think that me as a pharmacist will use a lot of AI because I deal with a lot of medicine, right?
Yeah.
Yes. Yeah.
As a surgeon, I agree with what Andy's point she said just now, that pharmacist is most likely to use the AI regarding in their department. As we all already know that we are in 2025, right? So even at China itself, in the Department of Surgery, there are enhanced in robotic and AI things that occur there, but in order to make the robot to undergo the operation itself, there still need us, the doctor, who have the knowledge to control the robot itself to make the surgery successful. So it's like 50-50. Human power and also the artificial intelligence itself to make our work easier.
Okay, last question for you guys. How do we ensure that AI development is guided by ethical standards to prioritize patient safety and well-being?
So we ensure the AI development is guided by ethical standards by using strict guidelines and regulations. So in hospitals, there are always strict guidelines and regulations that doctors must follow. So as pharmacists and maybe other healthcare professionals, the way they should work with AI is that they should work closely with the AI developers to ensure that the systems are accurate and safe for patients. Since we all know that maybe the AI developers, they may not have any experience about healthcare things, and we as the medical professionals, we must ensure that the developers must know what they are doing and maybe not try to cross the boundaries. So regular updates and audits should be done to check for errors and the biases in AI recommendations, so they do not actually give the wrong medication to our patients. Since our patients is our number one priority. So pharmacists also must remain control in the final decisions, because as I said just now that AI, they may make mistakes. So for us as pharmacists, we have a lot of knowledge. We studied for years about medications, and since AI made the mistakes, we must correct them, because who will? It's not like the AI developers will correct their mistakes, because they do not have any knowledge about the medical stuff. So that's all what I need to talk about.
Okay, so for me as a nurse, ensuring that AI development follows ethical standards is critical to ensuring patient safety and well-being. AI should never replace the compassionate care that nurses provide, but rather serve as a tool to support and enhance that care. So here's how we can ensure ethical AI development. So AI tools should be transparent and understandable for nurses and also other healthcare providers. When we are using AI, we must be able to understand how decisions or recommendations are made, so we can trust and validate them in the context of a patient care. And nurses should never feel like they are blindly following a machine's recommendation without understanding the reasoning behind it. So if AI suggests a treatment or course of action, it is important that we are able to explain this to our patient and provide the appropriate context. So this can help build the trust between the healthcare team and also the patient that we care for. So as a nurse, I see the potential of AI to improve care through automation and advanced monitoring. I also recognize the importance of maintaining the human aspect of healthcare. AI can assist with data analysis and decision support, but it cannot replace the empathy, the critical thinking, and personal connection that nurses provide. Ensuring that AI development is patient-centered, transparent, and regularly assessed will help ensure that it enhances our ability to care for patients while keeping their safety and well-being at the forefront. Thank you.
Thank you, last, Dr. Ari.
So as a surgeon, I have been witnessed firsthand how technology has transformed the operating room. So from robotic assisted procedures to AI driven diagnostics, we are at the forefront of a revolution. So but with this progress comes responsibility. So how do we ensure that AI in surgery serve our patient ethically, safely and effectively? So firstly is patient-centered AI development. So first and foremost, AI in healthcare must be designed with the patients at its core. So every algorithm, every robotic system, every decision support tool must prioritize patient safety over efficiency or cost cutting. We must ask, does this technology improve patient outcomes? Does it reduce complications? Does it enhance or not replace human expertise? So second is the surgeon remains the decision maker. AI can assist, but it cannot replace the judgments of a skilled surgeon. No AI should dictate a surgical decision without human oversight. The responsibility and the accountability must always rest with the human professional. AI should serve as a guide, not a substitute. So the future of AI in surgery is not about replacing surgeons. It's about empowering them by adhering to ethical principles, ensuring transparency, and keeping patients' well-being at the center of AI development. So we can create technology that truly enhances surgical core. The scalpel remains in human hands. AI is here to help, not to replace. So thank you.
Thank you so much for our panels here because we didn't need to answer all of my questions. Do you guys okay if I open a Q&A session for our audience today to ask if they have any inquiries?
Yeah,
Yes. Okay, I think we have no question for today's. But if you guys, audience, have some questions of inquiry about AI or any question about health, you guys can email us at emails below. Okay, so we have come to our end of discussion today. As I can conclude that it's clear that AI is transforming healthcare in ways we never imagined, from assisting in medication management to enhancing patient care and revolutionizing surgical procedure. Technology has undoubtedly become a powerful tool in modern medicine. So, however, as our panelists have highlighted today, while AI can improve efficacy, accuracy, and decision making, it cannot replace the critical human element of healthcare and compassion. So, ethical reasoning and personalized patient care. The role of healthcare professionals remain essential in ensuring that AI is used responsibly, ethically, and as a support system rather than a replacement for human judgment. So ultimately, the future of medicine isn't about AI versus humans. It's about collaborations. By embracing technology while upholding the core values of healthcare, we can create a system that is both innovative and patient-centered. Okay, so I would like to extend a sincere thank you to our panelists today, pharmacist Ms. AIMAN and our head nurse Ms. AQEELAH and our neurosurgeon Ms. FARHANA for sharing their expertise and insights today. So your contributions today have given us a lot to think about as we navigate the evolving landscape of AI in healthcare. And of course, thank you for our audience for being part of our conversation today. Stay tuned and wait for the others episode. Maybe we invite other doctors from maybe overseas again. Thank you guys.
Thank you.
Woo!